Hello, I'm Susana Aguilar, and I'll be talking about emotional behavioral disorders in children. One of every five children has a mental health problem or disorder that is likely to disrupt his or her ability to perform age-related activities. Emotional behavioral disorders are those that make it difficult for a child to regulate his or her emotions. This causes children to behave in less than acceptable behavior towards themselves and others. There are four diagnoses that I will be talking about in this presentation that make up emotional behavioral disorders: bipolar disorder, obsessive compulsive disorder, opposition defiant disorder, and conduct disorder. Bipolar disorder is genetic and follows through with family history. A child or adolescent will experience major depression and mania or hypomania. They will have so much energy and will be disruptive, are easily frustrated, impulsive, and can even have delusions. Children do not know how to accurately express their emotions and will mask it with stating that they are bored, that they're mad, restless, that they don't like their friends anymore, and that they don't like school. This can cause them to be defiant, talk excessively, and have poor judgment. This can hurt their sleep. They can become overweight, have a loss of appetite, and even neglect to play with others or hang out with their friends. The OT practitioner works with the health care team to minimize the effects of the disorders on functional abilities and occupation. Some of these occupations include ADLs, IADLs, and activities that have to do with social participation. Obsessive compulsive disorder presents symptoms of recurring, disruptive, intrusive thoughts that cause anxiety and compulsive, ritualistic, repetitive patterns of behavior that reduce anxiety. There is not a specific cause of OCD in children, but some factors that contribute are brain structure, early life trauma, genetics, and stress. If a child tries to ignore this behavior, the anxiety worsens. The child will continue to have worrisome thoughts that are irrational and obsessive. A child has compulsive behaviors of rearranging, ritualistic routines, and acts in ways to prevent harm to family members. This behavior disrupts with their daily routines, concentration in school, and task completion. OT practitioners can help treat with cognitive behavioral therapy. They focus on controlling those routines, especially ADLs. Characteristics of oppositional defiant behavior include being disobedient, hostile, and even defiant towards authority figures. This behavior is more than just normal childhood misbehavior and must be persistent for at least 6 months. Causes that lead to ODD are influences such as parents with substance abuse disorders, neglect, genetics, frequent changes in moving or relocating from schools, peer rejection, and exposure to violence, and even parents who are separated. Children show aggression and defiance while trying to irritate others. This can be perceived as hot tempered, disobedience, arguing with adults. They can blame others for unwanted behaviors, anger, throwing tantrums, and they can act out at school. This disorder can impact the child's ability to concentrate in school, to cause trouble and disciplinary misconduct in class, and does not have a good social relationship with others. An OT practitioner can assist the child with behavior management techniques. They can use cognitive behavioral therapy and stress relieving activities. Children can be guided for their social participation, ADLs, and IADLs. Conduct disorder is classified as repetitive and persistent patterns of behavior in which the basic rights of others or major age-appropriate societal norms and rules are violated. Both genetic and environmental factors take part in causation. Children who have difficulty in social interactions with others and receiving social cues also can have conduct disorder. Children can act selfishly, they can be bullies and threaten others, they can act aggressively and get into fights, and can even participate in animal cruelty. Some children even go as far as setting fires, they steal and begin to abuse drugs and alcohol. Children will have disregard for basic social skills, with standards and rules which can cause trouble learning in school. The misbehavior leads to failure in academic progress. The OT practitioners can help a child cope with misbehavior by conducting problem-solving activities, promoting self-regulation, and stress management. These are only a few of many emotional behavioral disorders in children. What are some of the most common? Thanks for watching.